Dear students, in the first module, we studied about the introduction of forensic psychology. After studying this module, you shall be able to know some general types of psychological disorders, their significant characteristics, their common causes and symptoms. First, the introduction. Psychological disorders are not new to the human civilization. Rather, since the advent of human civilization, these disorders disturb the human minds. Several crimes are committed under the influence of such disorders. The nature of cause, to some degree, is a topic of debate. For some intellectuals, these are fiction of minds, while some believe the cause is due to disbalance of biological functioning of human sensory organs. However, whatever may be the cause, but the truth behind these disorders is quite bitter, and the victim had to face lots of suffering mentally as well as physically. Now we shall go with some common terms of forensic psychology. First is amnesia. The term amnesia came from a Greek word amnesia meaning memory and a means without. So amnesia is actually a deficit in memory produced by brain damage, disease or psychological trauma. Amnesia can also be affected temporarily by the use of several sedatives and hypnotic drugs. Basically, amnesia is loss of memory. The memory can be either entirely or incompletely lost according to the extent of damage that was caused. There are two main forms of amnesia. First is retrograde amnesia. It is the incapability to recover information that was attained before a specific date, typically the date of a fortune or operation. In several cases, the memory loss can prolong back decades, while in others, the individual may miss only a few months of memory. Second is anterograde amnesia. It is the incapability to convey new information from the short-term store into the long-term store. Individuals with this form of amnesia will not remember things for long periods of time. These two kinds are not jointly exclusive. Both can happen within a patient at one time. Case studies often display that both kinds of amnesia can arise concurrently. In individuals suffering with amnesia, the capability to recall immediate information is still reserved, and they may still be capable to create fresh memories. However, a severe reduction in the ability to learn innovative material and retrieve old information can be observed. Patients can learn new procedural knowledge. Amnestic patients also preserve considerable knowledgeable verbal and social skills in spite of thoughtful damages in the skill to remember particular information encountered in prior learning episodes. Next is bipolar disorder. Bipolar disorder, also known as bipolar affective disorder or manic depression, is a mental illness characterized by episodes of an elevated mood known as mania, usually changing with the incidence of depression. About 3% of individuals have bipolar disorder worldwide, a portion stable for both men and women and across racial and ethnic groups. The reason is not evidently understood, but both genetic and environmental threat issues are supposed to play a part. Characteristics of bipolar disorder. During mania, a person looks unusually happy, active or irritable, but frequently makes poor choices due to impractical ideas or poor regard of consequences. Manic and depressive incidents can damage the person's skill to work in normal life. Mania is the significant characteristic of bipolar disorder and can happen with various stages of severity. With slighter levels of mania called as hypomania, persons seem to be active, emotional and may be extremely creative. As mania worsens, individuals begin to exhibit erratic and impulsive behavior, often making poor decisions due to unrealistic ideas about the future and sleep very little. At the very severe level, manic individuals can feel inaccurate philosophies around the world called as psychosis. On the other hand, a depressive episode usually tracks an incident of mania. Signs and symptoms of the depressing phase of bipolar disorder comprise constant feeling of grief, nervousness, guilt, anger, separation, hopelessness, disturbances in sleep and appetite, exhaustion, and lack of interest in usually pleasurable activities, difficulties focusing, aloneness, apathy, depersonalization, lack of interest in sexual activity, shyness or social nervousness, irritability, chronic pain with or without an identified cause, absence of inspiration, and dark suicidal thoughts. Next is confabulation. In terms of psychology, confabulation is a memory disturbance which is defined as the production of fabricated, distorted, or misinterpreted memories about oneself or the world, without the conscious intention to deceive. Confabulation is differentiated from lying as there is no intent to trick and the individual is ignorant the information is false. Though persons can represent deliberately fabricated information, confabulation can also seem to be coherent, within constant and comparatively usual. Persons who confabulate display inappropriate memories fluctuating from delicate changes to inexplicable fabrications and are very usually self-reliant about their recollections despite contradictory evidences. Most well-known cases of confabulations are symptoms of brain injuries or dementias, like Alzheimer's disease or Wernicke-Korsakoff syndrome, a common manifestation of thiamine deficiency caused by alcoholism. Characteristics of confabulation. There are several characteristics associated with confabulation, which includes typical verbal statements but can also be non-verbal gestures or actions. It also can comprise non-fictional and non-personal information like historical evidences, fairy tales or other parts of semantic memory. Apparently, the description can be imaginary or coherent. Both the evidence and the particulars of the account can be false. The interpretation is usually taken from the patient's memory of real experiences, comprising past and existing opinions. Usually, the patient is unaware of the account's distortions or inappropriateness and is not concerned when errors are pointed out. There is not at all hidden motivation behind the account. The patient's personality structure may play a role in their readiness to confabulate. Next is dementia. Dementia is a broad category of brain diseases that cause long-term loss of the ability to think and reason clearly. That is severe enough to affect a person's everyday working. The most usual kind of dementia is Alzheimer's disease. Dementia becomes more common with age. Though only 3% of individuals between the age of 65 to 74 have dementia, 47% of persons above the age of 85 have some kind of dementia. As more people are living longer, dementia is becoming more common. Dementia disturbs the brain's capability to think, motive, and remember clearly. The most usual affected areas comprise memory, visual spatial, linguistic, consideration, and administrative function, problem resolving. Several kinds of dementia are slow and enlightened. By the time the individual displays indications of the disease, the procedure in the brain has been occurring for a lengthy time. It is conceivable for a patient to have two kinds of dementia simultaneously. Around 10% of individuals with dementia have a mixed dementia, which is generally a combination of Alzheimer's disease and additional kind of dementia such as frontotemporal dementia or vascular dementia. Characteristics of dementia. The psychological and behavioral complications that repeatedly disturbs individuals having dementia comprises disinhibition and impulsivity, depression and anxiety, agitation, balance difficulties, agitation, speech and linguistic trouble, trouble eating or swallowing, delusions, often believing people are stealing from them, or hallucinations, memory alterations, considering that a memory has already occurred when it has not, thinking an old memory is a new one, joining two memories or puzzling the people in a memory, wandering or restlessness. Depression affects 20 to 30% of people who have dementia, and about 20% have anxiety. Psychosis, delusions of precaution, and anxiety or aggression also frequently escort dementia. When persons with dementia are put in conditions beyond their capabilities, there may be an abrupt alterations to tears or anger, which is known as catastrophic reaction. Next is delirium. Delirium, or severe confusional condition, is the order that exists in two elementary forms. In its hyperactive form, it is exhibited as severe misperception and confusion, emerging with moderately fast commencement and fluctuating in intensity, whereas in its hypoactive form, it is revealed by a correspondingly rapid withdrawal from interaction with the world. Delirium as a syndrome is one which takes place more often in persons in their advanced years, though it ensures in the passage of a critical illness. Delirium has been observed to follow in young and old persons as comparatively even rates. Delirium signifies an organically caused drop from a formerly achieved baseline level of cognitive function. Characteristics of delirium. Delirium is characterized by inconsistent course, attention deficits, and comprehensive severe disorder of behavior. It characteristically includes other cognitive deficits, variations in arousal, hyperactive, hypoactive, or mixed, perceptual deficits, changed 24-hour cycle, and psychotic symptoms such as hallucinations and delusions. Delirium itself is not a disease, but rather a clinical syndrome, a set of symptoms which results from an underlying disease, from medications administered during treatment of that disease is an acute phase, or from fluctuating arrangements of two or more of these factors. It is a consequence of the standards that an analysis of delirium cannot be prepared without a prior evaluation or information of the affected individual's baseline level of cognitive function. Next is fugue state. A fugue state, officially dissociative fugue or psychogenic fugue, is an uncommon psychiatric disorder recognized by reversal amnesia for personal identity, comprising the memories, personality, and other recognizing features of individuality. The stage is generally short-lived, fluctuating from hours to days, but can last months or longer. Dissociative fugue generally includes unexpected travel or thinking and is occasionally supplemented by the founding of an innovative individuality. After retrieval from fugue, former memories generally return unbroken, but there is usually amnesia for the fugue incident. Furthermore, an incident of fugue is not recognized as attributable to a psychiatric disorder if it can be associated consumption of psychotropic substances to physical trauma, to a common medical situation, or to psychiatric circumstances like delirium, dementia, bipolar disorder, or depression. Fugues are commonly caused by a stressful episode, and upon recovery there may be amnesia for the real stressor. Next is hallucination. A hallucination is an opinion in the lack of apparent stimulants that has potential of actual awareness. Hallucinations are vivid, considerable, and situated in exterior objective space. They are differentiated from the connected phenomena of dreaming. which does not comprise sleeplessness. Hallucinations also diverge from delusional perceptions, in which an appropriately detected and interpreted stimulus, that is, a real perception, is given some additional significance. An insignificant form of hallucination is identified as a disturbance and can happen in most of the senses overhead. These may be things like watching movements in peripheral vision or audible range dim sounds. Like auditory hallucinations, the source of the visual matching part can also be after the patient's back. Their visual counterpart is the feeling of being looked or stared at, usually with malicious intent. Often, auditory hallucinations and their graphic counterpart are felt by the patient together. Hallucinations can be associated with drug use, particularly deliriums, sleep deprivation, psychosis, neurological disorders, and delirium treatments. Classification of hallucination. Hallucinations may be revealed in a diversity of forms. Several forms of hallucinations affect various senses, occasionally occurring at the same time, generating numerous sensory hallucinations for those feeling them. First is visual hallucinations. Visual hallucinations is the seeing of things that are not there. Most consumers define it by the third eye, by which they can perceive things others cannot. Stronger hallucinogenics have been described to have an effect leading the user to see him or herself in a different world and having a different life. Second is auditory hallucinations. Auditory hallucinations, also called as parakinesia, are the insight of sound without any stimulus. Auditory hallucinations are very general in paranoid schizophrenia. They may be generous, expressive, the patient morale thinks about themselves, or malevolent, troubling the patient, etc. Auditory hallucinations of the malevolent type are often heard. For example, people speaking about the patient, his, her back. Auditory hallucinations can be separated into two groups, elementary and complex. Elementary hallucinations are the perception of sounds such as hissing, whistling, an extended tone, and more, while complex hallucinations are those of voices, music, or other sounds that may or may not be clear, may be familiar or completely unfamiliar, and friendly or aggressive, among other possibilities. Hallucinations more than one speaking sounds are mostly associated with psychotic disorders like schizophrenia and cause special significance in diagnosing these disorders. Although several individuals not travail from diagnostic mental disease may occasionally hear sounds also. Third is tactile hallucinations. Tactile hallucinations are the deception of tangible sensory input, pretending several kinds of force on the membrane or the organs. Like one subtype of tactile hallucination, formication, is the sensation of insects crawling underneath the skin and is frequently associated with prolonged cocaine use. Fourth is gustatory. This type of hallucination is the perception of taste without a stimulus. These hallucinations, which are usually strange or unpleasant, are relatively common among individuals who have certain types of focal epilepsy, especially temporal lobe epilepsy. Next is illusion. The term illusion refers to a specific form of sensory distortion. Unlike a hallucination, which is a distortion in the absence of a stimulus, an illusion describes a misinterpretation of a true sensation. For example, hearing voices regardless of the environment would be a hallucination, whereas hearing voices in the sound of running water or other auditory source would be an illusion. An illusion is a distortion of the senses, revealing how the brain normally organizes and interprets sensory stimulation. Though illusions distort reality, they are generally shared by most people. Illusions may occur with any of the human senses, but visual illusions, optical illusions are the most well known and understood. The emphasis on visual illusions occurs because vision often dominates the other senses. Classification of illusion. First is optical illusion. An optical illusion is identified by visually seen images that are not true or misguiding. Thus, the information collected by the eye is evaluated by the brain to give on the face of it a percept that does not match with the physical measurement of the stimulus source. The human brain forms a world within our head according to what it samples from the surrounding environment. Although sometimes it arranges the information it considers best, while most of the times it covers in the gaps. This manner in which our brain functions is the basis of an illusion. Second is auditory illusion. An auditory illusion is an illusion of listening. The sound equal to an optical illusion, the listener hears either sounds which does not exist in the stimulus or impossible sounds. Third is tactile illusions. Tactile illusions are illusions that exploit the feeling of touch. One of the best known tactile illusion is the cutaneous rabbit illusion, in which a sequence of taps at two separated skin locations results in the perception that intervening skin area were also tapped. Next is neurosis. Neurosis is a branch of functional mental disorders comprising distress but not delusions nor hallucinations, whereby behavior is not acceptable norms. Thus, the contact with the reality is not lost. It is also called as psychoneurosis or neurotic disorder, and thus those undergoing from it are called to be neurotic. Characteristics of neurosis. There are many forms of neurosis: obsessive compulsive disorder, OCD, anxiety neurosis, hysteria, in which anxiety may be discharged through a physical symptom, and an approximately infinite diversity of terrors as well as fascinations such as pyromania. Effects of neurosis can comprise nervousness, sadness or depression, rage, irritability, mental confusion, low feeling of self-worth, etc. Behavioral indications like phobic avoidance, attentiveness, spontaneous and obsessive acts, tiredness, etc. Mental problems like unpleasant or troubling views, repetition of opinions and fascination, habitual fantasizing, negativity and cynicism, etc. Interpersonally, neurosis comprises dependence, violence, perfectionism, schizoid, separation, socio-culturally unsuitable behaviors, etc. Next category is psychosis. The term psychosis is originally derived from the Greek word psyche, meaning mind or soul, and osis, meaning abnormal condition or derangement, refers to an abnormal condition of the mind. It is a non-specific psychiatric term for a mental condition frequently defined as comprising a loss of contact with reality. Individuals going from psychosis are described as psychotic. The term psychosis is very comprehensive and can be everything from comparatively normal unusual experiences by the complex and unresponsive expressions of schizophrenia and bipolar disorder. In appropriately detection of psychiatric disorder, psychosis is a vivid term for the hallucinations, delusions and sometimes violence. Psychosis is commonly given to observable deficits in usual behavior and more usually to varied kinds of hallucinations or delusional beliefs. Example, grandiosity, delusions of persecution. People suffering psychosis may display some personality variations and belief disorder. According to its severity, this may be escorted by uncommon or strange behavior, as well as trouble with social communication and damage in carrying out daily life activities. Characteristics of psychosis. People with psychosis may have one or more of the following: hallucinations, delusions, catatonia, a profound agitated state in which the experience of reality is usually well thought out, impaired, or a thought disorder. Impairments in social cognition also occur. Next is psychopathy. Psychopathy or sociopathy is conventionally well defined as a personality syndrome recognized by persistent antisocial behavior, reduced empathy, and disinhibited or bold behavior. It may also be defined as a non-stop aspect of personality, instead of scores on various personality dimensions found all over the population in varying combinations. Though no psychiatric or psychological organization has authorized an analysis titled psychopathy, valuations of psychopathic features are broadly used in criminal justice settings in various nations and may have vital consequences for persons. Next is stupor. Stupor is the lack of critical cognitive function and level of consciousness wherein a sufferer is almost entirely unresponsive and only responds to base stimuli, such as pain. An individual is also stiff and silent and only looks to be aware as the eyes are open and follow nearby objects. Being recognized by injuries of reactions to external stimuli, it is generally seen in infectious diseases, complicated toxic states, severe hypothermia, mental illnesses like schizophrenia, severe clinical depression, and so on. Characteristics of stupor. If not stimulated superficially, a person with blankness will be a drowsy condition most of the times. In several extreme cases of severe depressive disorders, the person can become motionless, lose their appetite, and become mute. Short periods of restricted responsivity can be attained by intense stimulation, example pain, bright light, loud noise, and shock. We'll end this module with a summary. The term amnesia is originally derived from a Greek word amnesia, meaning memory, and a means without. Thus, amnesia is in fact a dearth in memory triggered by damage in brain, illness, or psychological disturbance. Bipolar disorder, also known as bipolar affective disorder, manic depressive disorder, or manic depression, is a mental illness characterized by episodes of an elevated mood known as mania, usually alternating with episodes of depression. Confabulation is a disturbance in memory which can be well defined as the fabrication of fictitious, distorted, or misinterpreted memories about oneself or the world, devoid of the sensible intent to mislead. Dementia is an extensive class of brain diseases that causes long-term memory loss and ability to think and reason clearly. That is starkly adequate to upset an individual's daily working. Delirium or acute confusional state is a condition that presents in two elementary forms, that is hyperactive form and hypoactive form. A hallucination is a perception in the lack of obvious stimulus that has qualities of real perception. On the other hand, an illusion defines a misinterpretation of a true sensation. Neurosis is a class of functional mental disorders including distress. On the other hand, neither delusions nor hallucinations whereby behavior is not outside socially acceptable norms. Instead, psychosis is a generic psychiatric word for a mental state often defined as encompassing a loss of contact with the reality. Psychopathy or sociopathy is usually well defined as a personality disorder categorized by enduring antisocial behavior, diminished empathy, and disinhibited or bold behavior. Stupor is defined as the lack of serious cognitive function and level of consciousness in which a subject is almost completely unresponsive and only reacts to base stimuli such as pain.